So this is going to be a two lecture series. पहले में I'm going to talk about the anatomy of maxillary sinus, and then उसके बाद we're going to talk about sinusitis and orodental communication. ठीक है? So what are paranasal sinuses? So these are just the hollow cavities in the skull in the mid-face region. Okay? So we have different types of paranasal sinuses. Basically, चार हैं: maxillary, ethmoid, frontal, and sphenoid. Okay. So these are named based on the bone that they are present in. So maxillary sinus is present inside the maxillary bone, right? Maxilla. One second. Ethmoid sinus in the ethmoid bone, frontal sinus in the frontal bone, and sphenoid in sphenoid, right? Okay. So what are the functions? So they are hollow cavities, right? So first function is that they reduce the weight of the midface and the skull. Okay, उतना ज़्यादा heavy feel नहीं होता हमें. If they are filled with, जैसे आपको if you have common cold, you feel heavy in the cheek region because they are totally filled with the mucus. So weight increase हो जाता है, the sinuses are blocked. That is why you feel the heaviness in the cheek region and the forehead region, right? So that is first, lightening, reducing the weight of the skull and the midface. And second is when we breathe, it tends to humidify the air that we take in. Dry नहीं रहता है. Dry से irritation ज़्यादा होता है. Whereas with humidified air, the irritation is less. That is one. Second, again common cold के example में you feel that your voice is slightly different, right? Why? Because normally when we talk, अभी भी मैं बोल रहा हूँ, there is some resonance, right? The same thing goes in the sinuses. When we speak, the air resonates inside the sinuses, so our voice resonates. So third function is the resonance of the voice. Okay. Then trauma हो गया midface. Okay. So these act as a shock absorbers, एक तरह से बोल सकते हो. So they have very thin walls. Okay. So if there is a high force, high intensity force in the midface region, okay. So these structures, these sinuses, they tend to crumple and they absorb the force that is being applied on the midface region. Okay. So they tend to prevent the injury to the brain, skull. Okay. So they act as shock absorbers. Okay. Then they have, they are lined with mucous membrane. Okay. So these mucous membrane, they secrete mucus. Okay. So they prevent drying of the membranes. The epithelium, that is not only the sinus, also the nasal membrane also. It prevents the drying of the nasal membrane, mucous membrane, because these sinuses, they secrete the mucus that is covering the nasal mucosa also. Okay. So these are the functions of the change हो रहा है नहीं हो रहा है of the maxillary sinus. And today we are going to talk about maxillary, or not only maxillary sinus. These are the functions of all of the sinuses in general. Then today we are going to talk about the maxillary sinus, and these are the functions जो मैंने बताया. They reduce the weight, humidification, resonance, crumple zone. They act as shock absorbers and they keep the nose from drying out. Okay, so this is the maxillary sinus, and let it be. Okay, so common sense, they are two in number, each on one side, left and right, and it was first described by Nathaniel Highmore. That is why it is also called as antrum of Highmore. Okay. So sinus and antrum both are one and the same thing. Okay. So it is the largest paranasal sinuses. Let me show you. इसमें images नहीं. So it is the largest paranasal sinus, and it lies in which bone? Maxilla, right? Okay. Next. So you can see these are the maxillary sinus, one and this on the left side. Okay. So it is inside the maxillary bone. Here we have the suture that is present between the palatal bone and the maxillary alveolar bone, right? यहाँ पे suture होता है. Okay. So it is in the maxillary sinus is in contact with the palatal bone also, hard palate, and on the lateral surface we have the zygomatic bone here, right? So there's something about sinuses in general. They pneumatize. Pneumatize means they expand in size as the age progresses. Okay. So as age progresses, there are chances that this sinus, it might expand into the hard palate and the zygomatic bone. Okay. बाकी डिटेल में मैं बताता हूँ बाद में. And another thing also that this, it also expands into the lateral wall of the nose. Okay, but इसमें it doesn't only perforate. एक side पे there is resorption on the lateral surface of the surface of the bone, on the lateral portion. There is resorption of the bone, but on the medial aspect there is deposition of the bone. So this sinus, it grows into the lateral wall. Okay, it doesn't. You can say it resorbs, but there is also deposition of the bone. So it grows into the nasal cavity as the age advances. Okay, इतना समझ आया? Okay. So as I mentioned earlier, we have this maxillary bone, जिसमें we see the sinus. Okay, and then this is the zygomatic bone. Okay, this will come into play later on. Okay, so it lies in the maxillary bone, and it may extend into palatal bone, hard palate, zygomatic bone, okay, zygoma, and it can grow into the lateral, grow into the nasal cavity. Okay, why it doesn't perforate and create a like perforation क्यों नहीं करता? Because towards the maxillary sinus there is resorption, but on the medial wall there is deposition of new bone, तो वो hole नहीं होता है. Okay, so anyways. Okay, now we come to the dimensions of the maxillary sinus. So this is medial and this is lateral. So medial laterally it is approximately 27 mm. आपके book में 2.7 centimeter है. Okay, so I'm going to talk about this in mm. So this is medial laterally 27 mm, and now it is not an absolute value, it is a range. मैंने बोला approximately 27 mm. It can be less in some cases, it can be more in some cases. This is the average size in a average individual, adult individual. Okay. Then anterior posteriorly the dimension is 3.5 centimeter or 35 mm. Okay. This is anterior आगे, and this is posterior. Okay, so anterior posterior we have the dimension of maxillary sinus, that is approximately 35 mm, and then superior inferiorly, you can also say height of the maxillary sinus, it is 32 mm, approximately 32 mm. Okay, so these are the dimensions: medial laterally 25 mm, anterior posteriorly 35 mm, and superior inferiorly 32 mm. And the volume is in the range of 15 to 30 ml in an average adult individual. So by volume इसमें अगर आप saline डालोगे तो 15 से 30 ml saline उसमें fit होगा. Simple. Okay. So it is pyramidal in shape, as you can see. The base of this pyramid is at the lateral wall of the nose, and the apex is extending into the zygomatic process of the maxilla. So this is the zygomatic process of the maxilla. यहाँ तक maxilla है, and process is what? It is an extension of a bone, right? So this is the zygomatic process of the maxilla, which continues after the suture as the zygomatic bone, right? So the base of this pyramid is at the lateral wall of the nose, okay, and the apex, it extends into the zygomatic process of the maxilla, and as the age progresses, this apex, it can grow into the zygomatic bone also, zygoma. Okay, so as I said, base, lateral wall of the nose, apex, it projects towards the zygomatic process of maxilla, and this pyramid has 4 walls. Okay, I'll show you the images if I have. ये वाली नहीं, let me see. Yeah, so it has 4 walls: anterior, posterior, roof, and the floor. Okay, now roof, what is this? इसके ऊपर क्या है? Orbit, right? So roof is made by the orbital floor. Okay, orbital bone you can say, and floor is made by the alveolar process of the maxilla. Okay, समझ आया इतना? And then anterior is formed by the anterior surface of the maxillary bone, or anterior surface of the maxilla, right? And posterior wall is the infratemporal surface of the maxilla, जहाँ पे हम PSA देते हैं, infratemporal fossa, right? So these are the walls. Roof is orbit, floor is the alveolar process of the maxilla, anterior wall is the anterior surface of the maxillary bone, posterior wall is the infratemporal surface of the maxillary bone. Okay, अभी तक समझ आया? With me till now? Okay, उल्टा रखा है, ठीक है. बिकॉज मैं इसलिए फिर से रिपीट कर रहा हूँ, दिस इज गोइंग टू कम इन टू प्ले विद द साइनोसाइटिस एंड ओरिएंटल कम्युनिकेशन. ओके, सो इतना याद रखोगे, एग्जाम में भी काम आएगा एंड इन जनरल प्रैक्टिस में भी काम आएगा. एनीवेज, सो this maxillary sinus, all of the sinuses, they open into the nose. Okay, so maxillary sinus also opens into the nose. Okay, in the middle meatus, this space is the meatus, and this bony prominence, bony process is the middle concha or tragus, not tragus, क्या था उसका, मैं भी भूल गया हूँ. Anyways, turbinate, middle turbinate. So anyways, ostium क्या होता है? It is just the opening of the maxillary sinus in the middle meatus of the lateral wall of the nose. This is the middle wall. This is the lateral wall of the nose, nasal cavity. Okay. So let me zoom in. So we have these processes. Okay, in the lateral wall of the nose, that is the middle turbinate and inferior turbinate. ऊपर एक छोटा सा भी है superior turbinate. But lateral to the middle turbinate, we have the ostium that I'll show you. So you can see we have the ostium, that is the opening of the maxillary sinus into the lateral wall of the nose. Okay. Now this opening, if you just consider the bony opening, it is slightly larger as we see as compared to what we see clinically. Okay. It is usually 4 to 10 mm. Okay. 1 centimeter तक बड़ी हो सकती है in the lateral wall of the nose. But as it is covered by the mucosa, mucous membrane, mucous membrane. So उसकी वजह से, because of the thickness of the mucous membrane also, the dimension they reduce to 3 to 6 mm. So just if we consider only the bony dimension, it is 4 to 10 mm, and if we consider the dimension along with the mucous membrane, it is 3 to 6 mm. Okay, कम हो जाता है, समझ आया इतना? Okay, so now if you compare this is the ostium, and this is present at the lateral wall of the nose. Okay, now if you see, this location of this ostium is in the superior with respect to the maxillary sinus. Okay, ये maxillary sinus उससे थोड़ा सा ऊपर है, the location of the ostium, right? And maxillary sinus actively secretes mucus, right? And this mucus has to come out to cover the nasal mucosa also, right? Another thing, if there is infection in the maxillary sinus, there is pus formation or any foreign body be here, suppose. So it has to be actively drained out of the ostium, through the ostium, right? But it has to flow against gravity. If I'm standing like this, if there is any foreign body or there is mucus secretion, it has to flow against gravity to come out of the maxillary sinus. Okay? So that is where we have this, the role of the maxillary sinus membrane comes into play. Okay, the maxillary sinus membrane is also called as Schneiderian membrane. Okay, so it is a pseudo stratified ciliated columnar epithelium. Stratified का मतलब क्या है? Multiple layers of epithelium. Pseudo stratified का मतलब क्या है? It is not actually stratified, but because of the placement of the cells, you can see this is a single layer, but इसमें placement of the nuclei is so aberrant that हमें feel होता है कि there are two layers. यहाँ पे भी nuclei है and यहाँ पे भी nuclei है. So it gives an impression of multiple layers, but it is not multiple layers. That is one. And then we have cilia. Cilia क्या है? Hair-like projection from the cells. They just move in unison. आपने ऐसे construction workers को देखा होगा, वो bricks pass करते हैं, right? एक बंदे ने throw किया, उसने catch करके आगे pass कर दिया. So they work in unison to move to actively remove whatever is being removed from the maxillary sinus, be it the mucus that is being secreted or any foreign body. Okay, so I'll show you an animation, a very rough animation I made. Time नहीं था. Let's see. So they are moving in unison. सारा एक साथ नहीं होता है. Okay, थोड़े से पोर्शन में आगे मूव होता है and then उसके आगे वाला पोर्शन मूव होता जाता है. So they actively carry anything that is being removed towards the ostium. Okay. So now we come to the lymphatics. It is by the submandibular nodes. Blood supply, facial, maxillary, infraorbital, greater palatine. So basically आपको इतना याद रखना, उसके आसपास कौन सी blood vessels हैं? They are the ones supplying. The same goes with the nerve supply. So in the superior, जो roof है maxillary sinus का, the orbital floor, in that we have the orbital canal, infraorbital canal. उसमें से we have the nerves that are being separated out, that is middle superior alveolar and anterior superior alveolar, right? So middle superior alveolar kya hai? It separates from the main trunk and comes down and traverses the medial surface of the maxillary sinus, जो medial wall है, okay, or you can say the roof of the not the roof नहीं हो, उसका क्या था, base of the pyramid, okay. So medial wall पे it goes down and supplies the premolar and mesiobuccal root of the first molar, right? Anterior superior alveolar comes and traverses the anterior wall of the maxillary sinus and supplies the anterior teeth, okay. And आगे से from the infraorbital foramen we have the infraorbital nerve, and on the posterior wall, the infratemporal surface of the maxilla, from there we have the PSA that is perforating the posterior wall and supplying the molars. इतना anatomy याद है, nerve supplies, you can correlate I hope, okay. So the nerve supply, अब nerves यहाँ पे हैं ही, why to have extra nerves, इन्हीं से supply कर देते हैं. So that's the nerve supply of maxillary sinus, okay. ASA, MSA, PSA, that's it, okay. So now we come to the applied surgical anatomy. What we mean by applied surgical anatomy is how the anatomy of maxillary sinus is going to affect your clinical practice or your surgical procedure, okay. So usually the distance between the apex of the premolar molars and the sinus floor is approximately 1 to 1.25 centimeter, okay. इसमें तो बहुत कम दिखाया है, but in an average adult individual, the distance between the sinus floor and the apex of the molar and premolars, it is usually 1 to 1.25 centimeter. But as the age progresses, as I told you, because of pneumatization, the sinus expands and there is bone resorption in the surrounding area, so the distance reduces with the age. But I have seen pneumatization in a 20-year-old female patient also. जिसमें the maxillary sinus was up to the middle half of the roots, okay. There was only this much bone available, itna half root ka, okay. So in some cases you can see pneumatization in young patients also. Excessive pneumatization तो early age से start रहता है, but excessive pneumatization can be seen in young patients also, but that is rare, okay. So what is the order of proximity? So second molar is the closest, then after that we have first molar, third molar, second premolar, first premolar, and canine. So why do we need to keep this in mind? Because while we extract in a normal individual or in a older individual, even if you don't have an IOPA, ideally I would suggest that you take a IOPA for every extraction patient, okay. But अगर नहीं भी है, if you are extracting a maxillary second molar, so you have to keep in mind that it is the closest to the maxillary sinus floor, okay. So if you don't have an IOPA, consider it that the roots, they are very close to the sinus floor, and while extracting there is a possibility कि you might create the oroental communication, okay. Now for some reason this floor, as I told you of that 22-year-old female patient, the sinus was till the middle half of the root, okay. Now we extract the tooth, वहाँ पे communication हो जाएगा, there was no bone, right. So if you don't have a radiograph, you have to assume that the sinus is very close to the roots, and if you extract there will be oroental communication, so you have to be very careful. इसीलिए बोलता हूँ हर केस में IOPL लेना है, okay. So depending on the order you have to be prepared mentally कि ऐसा हो सकता है, and you have to inform the patient. Of course, to avoid all of the confusion, easy way out is to shoot an IOPA, okay. Now as I mentioned earlier, young patient में the sinus will be smaller size, okay. So the chances of oroental communication is almost zero, or you can say very less in patients less than 15 years of age, okay. Then as I mentioned, why is the incidence less? Because there is pneumatization. As the age progresses, the sinuses, they expand, they cause resorption of the bone in the surrounding bone, okay. So it expands, and that causes expansion, increase in the volume of the maxillary sinus, okay. So as it expands, it becomes more closer and closer to the maxillary roots, maxillary, molar and premolar roots, okay. And suppose we have a periapical infection, caries, a patient didn't get the root canal done, there is periapical infection, periapical abscess. So one thing that can happen is abscess छोटा सा है, but the sinus is expanding and it has come closer to the abscess. So now initially the abscess was enclosed in the bone. Now the sinus is closer, so there is gradual perforation of the sinus floor. So this pus will go into the maxillary sinus, that will lead to sinusitis. Okay. Another thing is pneumatization itna zyada nahi hai, but the sinus, not the sinus, the abscess is expanding. Okay. It expands and perforates the floor of the sinus. Tabhi the same thing happens, we have maxillary sinusitis. Okay. Then pressure, yeah, this is important. There is infection of the maxillary sinus, not because of dental. Just assume there is no dental etiology in case of sinusitis, in case of infection of the maxillary sinus. But there is pus accumulation in the sinus, or you can say there is a tumor in the maxillary sinus. So because of the pressure from these things, abscess hoga, so there will be inflammation. Because of inflammation, there might be pressure on the nerves that are supplying the teeth. Okay, that is PSA, MSA, ASA, right? So because of that pressure, we might see pulpal anesthesia of these teeth. Okay, without block. Because of this, yeah, that nerve injury, even with the pressure, there might be stoppage of the conduction, nerve conduction, right? So this thing and that thing applies here. Because of the pressure from the inflammation, okay, or the tumor, there will be pulpal anesthesia of the posterior teeth, premolar and molar. And then we have tumors. We have tumors in the maxillary sinus. So it can appear clinically. Agar zyada bada nahi hai, to it might not present clinically, but as it grows and grows with time, there comes a time when the thin wall of the anterior maxilla, it is perforated by the tumor, and we can see the tumor as swelling in the cheek region, or you can see it as a swelling in the palate region. Palatal bone ko perforate karke, it will appear as a lump in the hard palate. Okay. So that is that. And as I mentioned, there will be paresthesia of the maxillary teeth because of the pressure. Also, there is something called as, in some cases, what the ENT surgeons they do is, if there is a chronic sinusitis and with conventional medications, the sinusitis is not being healed, treatment nahi ho raha, it is not responding well to the medical treatment. Tab kya karte hain, they remove all of the sinus lining. Okay, so they have removed all of the sinus lining, and we have the MSA at the medial wall and ASA at the anterior wall, PSA at the posterior wall, right? So when they curate the sinus lining, the chances are that they might damage these nerves, right? So that will lead to paresthesia of the premolars or molars after sinus surgery. Okay? Samajh aaya itna? Okay. Now, sinus membrane, it is particular that even if you remove a portion of the sinus membrane, it regrows. It regenerates easily. Okay. Even after this, manager example, the ENT surgeon, usually they remove all of the sinus membrane. So the sinus membrane, it is a continuation of the nasal membrane, nasal mucosa. Okay, so even if you remove all of the sinus membrane from the nasal mucosa, it regrows. Okay, there is regeneration from the nasal mucosa. So this thing is to be kept in mind. If there is a chronic sinusitis, you can open the sinus up and remove all of the lining, and still with time the sinus membrane it regrows. Okay. Then enterostomy. So usme kya, I showed you that ostium is present in the medial meatus. Okay, middle meatus, and inferior meatus is also there. Okay, now ostium is above the level of the maxillary sinus, right? So there is no passive flow of the content, right? There has to be active drainage using the cilia. Okay, now for some reason there is blockage of the ostium. Now 3 से 6 mm तक there is an opening of the ostium, right? Now if there is inflammation and increased mucus secretion, the chances are there is blockage of this ostium. तो वो content भी बाहर नहीं निकल रहा है. So what we can do is there is something called an enterostomy. Inferior meatus में we just insert the stellate. Okay, a sharp instrument. We just insert and we create a opening in the inferior meatus. Now inferior meatus is at the lower level. Okay, so easily it flows. You can compare it with the Hilton's method. बस हमने puncture कर दिया and we keep the puncture at the dependent site जहाँ से easily pus flow हो जाए. Same with this, we are creating the perforation in the maxillary sinus at the lower level, जहाँ से easily the content can be drained out, right? So that is enterostomy. Then we come to the canine fossa. Canine fossa region पता होगा canine के ऊपर रहता है, right? So this area is the thinnest of all. Okay, so anterior wall of the maxillary sinus, and that too, anterior wall of the maxillary sinus is already thin, and in that the maxillary canine fossa region, it is the thinnest in the anterior maxilla. Okay, so this is the site of choice if you want to open up the maxillary sinus. Okay, there is something called as Cardwell-Luck surgery. In that, what we do is we open up the maxillary sinus. If we want to remove the sinus membrane, we remove that, or if we want to remove the root, for example, I'll show you my own case. जिसमें मैंने maxillary sinus से I removed a tooth root. A BDS was extracting the tooth. उसने गलती से push कर दिया sinus में. So I was called in to remove the root from the sinus. मैं दिखाऊंगा next time. So I approached the the sinus from the canine fossa region. And sometimes what happens is the bone available in the edentulous maxilla is less. As I mentioned, with old age, the pneumatization is higher. So if you don't evaluate the bone before placing the dental implant तो सुना होगा, titanium screws होते हैं. So if you don't evaluate the bone properly and for some reason you have pushed the implant into the maxillary sinus, even that can be retrieved from the canine fossa region. Okay. The same thing, foreign body in the maxillary sinus, that can lead to infection. For example, a tooth root there was already infection in the tooth root, and we have pushed by mistake it into the sinus. That can lead to infection. Then we have something called as transillumination. Transillumination क्या होता है? We already know that the anterior wall is thin and palatal bone is also not that thick. So what we can do is just to check whether there is any presence of fluid in the maxillary sinus, like pus or blood. In case of trauma, जैसे maxillary sinus mid-face trauma जो रहता है, Lefort 1 or 2, anterior wall of maxillary sinus, anterior wall of maxilla is fractured. Okay, that will lead to bleeding into the maxillary sinus. Or zygomatic bone is fractured, ZMC fracture. So apex of the maxillary sinus, the pyramid, it is fractured. The chances that this zygomatic bone is pushed into the maxillary sinus or it rotates out, that is a different thing. But that will lead to bleeding and the filling of the maxillary sinus with blood. Okay. So it appears on the radiograph as filled. मैं दिखाऊंगा radiographs भी आपको. But this is to just assess whether the maxillary sinus is actually empty or whether it is filled. It can be because of the mucus, blood, pus, or it can be a tumor. Tumor से भी भरा हो सकता है. So basically concept क्या है? We have two thin walls. एक side से we shoot the light of high intensity. So if we shoot the light here, it becomes red, right? Because the light, there is still some light passing through. The same concept is here. आप light high intensity पे लगाओगे तो you will be able to see on the opposite side. I'll show you the picture. So basically, conventional method was to place a high intensity light source inside the mouth near the palate. Okay, and we'll be able to see the light coming out on the anterior wall of the maxillary sinus. Okay, and in this orbital floor. Okay. But this is not comfortable. So अब क्या करते हैं? Normally we place the light source outside and we view the intraoral side. Okay, I'll show you the video. So you can see, and yeah, another thing, to view this, you have to maintain some darkness in the room. Light on करके करोगे, you won't be able to appreciate that. Okay, so this appearance is seen when the maxillary sinuses,
dim the room lights and ask the patient to tilt her head back and open her mouth. Place the light source against the cheekbone just below the eye. The presence of a reddish glow on the hard palate indicates a normal air-filled sinus.
Can you appreciate it? Palatal bone पे, है ना? So this is the same for frontal sinus. Nose में से we illuminate. Okay? ये समझ आया? This is for testing, just to test whether the sinus cavity is empty or not. Using this, you cannot decide whether it is a tumor or a cyst or pus or mucus, not membrane. Okay. Now we come to the radiology. Radiology, you should first know how a normal sinus looks on a radiograph. Okay. This is the OMV view. You can see the maxillary sinus. This appears as a hollow cavity, clear cavity दिख रही है, right? On both the sides. I'm going to show you multiple such radiographs to show you the normal maxillary anatomy. Again, You can see the maxilla appearing as a hollow cavity. It appears black, grayish. Okay. Again, the same thing. Again, maxillary sinus appearing as a hollow cavity on both the sides of the face. Now, can you see this? ये side पे देखो. It is a totally hollow cavity, whereas here we see something. There is some accumulation of fluid in the maxillary sinus. Okay. दिख रहा है? I hope are you able to appreciate it? है ना? So you can compare the two sides. So now you can use this view to ascertain whether it is a fluid or it is a tumor or a cyst. कैसे पता चलेगा now? If it is a fluid, you can take the same view with patient's head tilted. Okay. If it is a fluid, it will be अब इसको पूरा टेढ़ा करके लेंगे तो क्या होगा? The fluid accumulates here, right? Whereas if it is a tumor or a cyst, वो अपनी जगह पे ही रहेगा. Okay. So that is how we use this view to differentiate between a fluid and a tumor. वैसे तो ये oral radiology का काम है बताना, but you understand this? Okay. Then orbital floor blowout fracture. There is herniation of the orbital content into the maxillary sinus. ठीक है? You can see the maxillary soft tissue, not maxillary, orbital floor का जो soft tissue है, fat है, muscles and they are herniating, they are hanging into the maxillary sinus roof. Okay. Then we have another pathology, that is a large periapical cyst, radicular cyst that has expanded into the maxillary sinus. Okay. Can you see this? Okay. Now if we ask the patient to tilt his head and take the same radiograph, the view won't change. Okay, because it is a pathology, not a fluid. It is a fluid-filled pathology, but it is a pathology. And this is what it appears in a CT scan. You can see this is a cyst that is filling the maxillary sinus. There is some small space available still, which is appreciated here also. Hai na? Can you see? Okay, you can compare the two sides. This is totally devoid of anything, be it fluid or a pathology, whereas here it is filled with the pathology. And here you can see the lateral wall is being expanded. Anyways, so this was a case of a large maxillary radicular cyst. Now, on a CT scan, you can see maxillary sinusitis on the left side because of the periapical infection. There is perforation of the palatal floor, and because of that there is infection of the maxillary sinus leading to maxillary sinusitis. Okay, and because of that there is pus accumulation in this area in the maxillary sinus. You can compare the two sides. Okay, so you can see the maxillary sinus filled with the pus, and you can also appreciate the sinus membrane, thickening of the membrane. Okay, initially what the body does is it tries to increase the thickness of the membrane to prevent the involvement of the sinus. It tries to localize the infection. Here you can see the tooth is perforating the floor, but there is sinus thickening, the thickening of the sinus membrane. It tries to localize the infection. But if we allow the infection to grow, then there will be sinusitis and involvement of the maxillary sinus leading to pus accumulation. Okay. This is the implant. मैंने example जो पहले बोला था. If you don't place a implant properly, it can lead to sinusitis because of the implant. Okay. So that was the normal radiology and some cases that shows the pathology of the sinus. So these are the radiographs that are used for viewing of the maxillary sinus. 15 minutes. Okay, so first is occipitomental view, जो मैंने पहले ही बता दिया है. You are able to appreciate both the maxillary sinuses and you can compare the two sides and decide which side is involved. Then we have the lateral skull view, in which we can clearly see all the four walls, that is roof, floor, anterior wall and posterior wall. Okay. Whereas in this we are able to appreciate the medial and lateral involvement, medial wall and lateral wall, superior and inferior, roof and floor. Okay. So here we can see the mediolateral involvement, whereas here we can see the anterior posterior involvement of the maxillary sinus. Whereas this is the submental vortex view, jug handle view भी बोलते हैं, and this is used to appreciate the posterior wall of the maxillary sinus. Okay, I'll show you. This is all of the sinus that is being shown. रुक जाओ. And Yeah, so you can see this is the posterior wall of the maxillary sinus. Okay, now these three views, that is occipitomental, lateral and submentovertex, these three views are used in conjunction to visualize all of the surfaces, all of the walls of the maxillary sinus. Okay, so occipitomental mein we appreciate the mediolateral involvement, whereas lateral mein we appreciate the anterior posterior involvement, and submentovertex mein we are able to visualize the posterior wall more clearly. Okay, so these three are used in conjunction to appreciate all of the borders, all of the walls of the maxillary sinus. Then we have another called as occipitofrontal view, also called as PNS view. Okay, it is used to visualize all of the sinuses, that is maxillary sinus, ethmoid and frontal sinus. तीनों साइनस को एक साथ व्यू करने के लिए यूज होता है. एंड देयर इज अ कंडीशन कॉल्ड एज पैनसाइनसाइटिस. साइनसाइटिस इज इन्वॉल्वमेंट, इन्फ्लेमेशन ऑफ द साइनस. Okay, pansinusitis means involvement of all the sinuses together. Okay, if we allow the sinusitis to progress, it is going to lead to involvement of other sinuses also. Okay, so we can appreciate pansinusitis with this view. Okay, then of course OPG mein it is clearly visible, the maxillary sinus. Don't look at this, fracture mat dekho, look at the maxillary sinus. So you can see the maxillary sinus here. Okay, and its relation to the maxillary molars and premolars. Here you can see one thing that you can see is there is septa. Okay, there are thin walls in the maxillary sinus, septa. They are not totally extending throughout the sinus. बस छोटा सा wall बनता है and it ends. Okay, these are called as septa. Okay, that is one thing. And as I mentioned earlier, pneumatization होता है. There is a equal resorption of bone throughout the maxillary sinus. But if there is a tooth present, the tooth ke around, because of the presence of the PDL ligaments, okay, the resorption of the bone around the tooth doesn't happen. तो क्या होगा, there will be a dome shaped bone around the tooth root, but उसके surrounding area में there is resorption, which is clearly visible here. यहाँ पे ऐसा dome shaped bone है and surrounding that area there is resorption. Okay, let me see अगर आगे होगा तो. So in this you can see the maxillary sinus in relation to the molar and premolar. Now remember, as I told you earlier, because of the presence of the roots, there is dome shaped bone present. Okay, agar if you don't see the dome shaped bone present, you can see clear continuous white line. That means there is an overlap, the root is not directly in contact with the sinus. Okay, so sinus ऐसा जा रहा है, it is medially or lateral to the sinus. Okay, ये ऐसा जा रहा है but it is medial or lateral, it is not in contact. Okay, तो overlap की वजह से we are seeing a straight line and we might get a क्या बोलते हैं उसको यार, we might misinterpret it as the roots in the maxillary sinus, but this root is not in the maxillary sinus. There is overlap, mediolateral overlap. Okay, when do we know that it is inside the sinus or it is very close to the sinus? When we see the bulging of the bone around the root. Okay, agar isme nahi hoga to I'll show it to you in the next case, next lecture. Here you can appreciate the septa, just the septa coming in. Okay, and again the sinus, it is pneumatizing into the maxillary tuberosity. Again, as I told you, now you can appreciate it here. There is dome shaped bone formation in this region. Can you see? यहाँ पे नीचे हो रहा है and then it grows here and again it goes down. So around the root there won't be resorption, but surrounding that area, around that area there will be resorption. Okay, so that is why we see dome shape. Now this has a higher chance of oroventral communication because we are sure that this much bone is available between the apex and the maxillary sinus. Just 1 mm bone is available. Okay, ठीक है, समझ आया इतना? So if there is a dome shaped bone, that means the root is immediately below the sinus. Remember this. Okay, then we have, of course, हर चीज में use होता है CT scan, tomography. I've already shown you the examples. You can appreciate the involved side because of the infected root, periapical abscess की वजह से we have the maxillary sinusitis and the sinus is filled with the pus. Okay, then thickening of the sinus lining, sinus membrane. Okay, then we come to sinusitis. The word is sinus plus itis. Oh, space गलती से आ गया. So sinus and inflammation of sinus. And odontogenic sinusitis, inflammation of sinus because of odontogenic reason. Okay, it can be because of periapical abscess or implant or any cyst of odontogenic origin or tumor of odontogenic origin. Okay, and as I mentioned earlier, pansinusitis is involvement of all of the sinuses together. Okay, now what can be the etiology? What can be the reason of the sinusitis? सबसे पहला तो इन्फेक्शन होगा पेरियापाइकल इन्फेक्शन और पेरिडोंटल इन्फेक्शन. ओके, कॉमन कोल्ड, लॉन्ग स्टैंडिंग कॉमन कोल्ड होगा, दैट विल एक्सटेंड इनटू द साइनस, वो तो आप लोगों को पता ही होगा, एक्सपीरियंस भी किया होगा. एंड देन अपर रेस्पिरेटरी ट्रैक इन्फेक्शन, इट कैन एक्सटेंड अपवर्ड टुवर्ड्स द nasal cavity and into the sinuses. Okay, then trauma is going to cause inflammation of the sinus membrane and sinusitis, allergy, neoplasm, infected cyst. Communication होगा तो whatever the content is in the oral cavity, जैसे patient कुछ खा रहा है, पी रहा है, it will be pushed into the sinus also. If there is communication between the sinus and the oral cavity, that will lead to sinusitis. Then, as I mentioned earlier, displacement, by mistake the dentist has pushed the root or the tooth or dental implant into the maxillary sinus. That will also lead to sinusitis. And blockage of the ostium. Now, this is important. When we breathe in, with the air, there is some foreign particles also being that are coming into the sinuses. Now we have the mucus that is being secreted by the mucous membrane. Okay, so इसमें वो चिपक जाते हैं, the foreign bodies, majority of the foreign bodies. Now these foreign bodies are being pushed out of the ostium and through the nose बाहर आ जाते हैं. बाकी मैं डिटेल में नहीं जाऊँगा. Okay, so if the ostium is blocked, तो जो content था, it is not being pushed out, that will lead to inflammation. Sinus mucus secretion is going on, and we also have these foreign particles that are lodged in the mucus. Okay, that will lead to sinusitis because of the blockage of the ostium. Now, how a spread of dental infection occurs to the maxillary sinus. Now, periapical abscess, आप लोगों को पता होगा, initially what happens if it is confined in the bone. Especially at night, the patient has a very severe throbbing pain, right? Why does the patient have throbbing pain at night? Any idea? Pressure, yes. When the patient lies down, blood pressure in the head region increases, and because of that, the patient has more pain during night or during day also if he sleeps. Okay. So if there is in the initial stage there is periapical abscess, there will be severe throbbing pain. And if it is closer to the maxillary sinus wall, okay, sinus floor, within 12 to 24 hours, it will perforate the sinus floor, and this pus is drained into the sinus. Now, this जो पहले pain हुआ था, that is relieved, okay, but sinus is involved now, and gradually there will be some mild throbbing pain because of that. Okay, now once the sinus is involved, there will be inflammation of the sinus walls also, and there is a possibility that anterior wall or any area where thin bone is present, it might get perforated, or because of only inflammation that will lead to swelling also. Okay, in the cheek, but it is not always present. Okay, then we have pus drainage. There is infection in the sinus. Okay, because of the dental origin, जो pus formation हो रहा है, that is being drained into the sinus. Now sinus से कहाँ से जाएगा? Ostium में. Ostium से it comes out through the nose. Now it can come out of the nose, or it can go back. Post nasal drip बोलते हैं. Okay, into the pharynx, nasopharynx. Okay. So दो चीजें हो सकती हैं. So the patient can complain of foul smelling fluid that runs down through the nostrils, or unpleasant taste or smell because of the post nasal drip into the nasopharynx. Okay, if there is periodontal abscess, you will see mobility of the tooth. Okay, because of the abscess, the sinus is involved, but we also see the mobility of the tooth. Okay, these are some signs, symptoms that we see in odontogenic sinusitis. Okay, and on radiograph you will see completely opaque maxillary sinus, or you will see fluid levels. Okay, if it is at the initial stage or moderately ज़्यादा duration नहीं हुआ, then you will see some fluid levels or half of the sinus is filled. If it is a long standing case, you will be able to appreciate a totally opaque maxillary sinus. Okay, because of the inflammation, ostium is also blocked, and all of the sinus is filled with the pus and mucus. Okay, so depending on the stage of the disease, depending on the progression of the infection, we might see completely opaque maxillary sinus, or we might see some level of fluid in the maxillary sinus. Okay, so management क्या होगा? जो source of infection है उसको हटा दो. Simple. So we can extract the offending tooth, be it involvement of the tooth with periapical abscess or periodontal abscess. Now, if there is involvement of the maxillary sinus because of the dental infection, तो it is very close to the sinus, right? तो उसको extract करेंगे, the possibility of orodental communication is very high. Okay, so you have to be prepared to close the communication also. We will discuss about that in the next lecture. Of course, infection है तो antibiotics देंगे. Ostium is blocked, so we are going to give nasal decongestion. Okay, so इससे क्या होता है? Nasal decongestion, they reduce the blood flow of the site. Okay, blood flow कम होगा तो interstitial fluid कम होगा and swelling भी कम हो जाता है. Okay, and to be continued, next time we are going to talk about classification, acute and chronic sinusitis, and orodental communication and fistula. Okay.